Good afternoon to those who are listening, good morning and good evening to others. I have the task to kind of sum up, and I think it is an easy task. Next slide, because we have seen that there is a separation, and we all around the table or in this webinar, and I think a lot of you outside listening think that it's not only surprising that oral and general health are separated, but it may be dangerous in places, as we have seen from India, for example. And so we wonder how we came to this. We even listened to Bruce in the beginning saying, yes, the dental and medicine. So even in our own mind, we think of medicine and oral is not, or dental is not medicine. We are quite brainwashed. So every evidence that we have heard so far tells us this should not be the case. We have seen from different places in the world, Taiwan, Ethiopia, India, Europe, it's worldwide. We are not the only ones. Everywhere there is this gap between oral and general health. We have seen that some local or national actions can help, can do something. But the question is now, can we do something on the global level, or haven't we done, or are we not good at leading the change? Next slide, please. Bruce also showed us the change theory of John Catter. We in public health have the change cycle. We say, first you have to have the problem. I think we know the problem. The problem is that we have an unnatural separation between oral and general health. We do have strategies, as we have seen, but we are not so good in implementation. Also, we have seen some good examples. So the question, besides these good national examples, would be, who are the ones at the global level who should do something? Next slide. Who are the stakeholders for global action? Well, we first think of our neighbors here in Geneva, the World Health Organization, but we may think of other UN organizations, such as the International Labour Office, because they are the ones also defining professions and the limits between them. We also should think at this level of the global world organizations of our professional organizations. So the umbrella organizations like the World Dental, the World Medical, or the International Council of Nurses. For truly and surely, we heard it, especially now from Mengistu, the governments are to be held in account. And I think, last but not least, health is a human issue, so of human rights, we have to work together with human rights proponents. So let's look at World Health Organization. Next slide. Yes, indeed, World Health Organization already in 2006 in her World Health Assembly, where the 194 health ministers worldwide meet every year in May, has clearly underlined that oral health is a serious public health problem and that there is an action plan for prevention and integrated disease needed. If we are in the wording of the World Health Organization, you will always hear universal health coverage. That means universal health coverage, all people have access to the health services they need, when and where they need, and without financial hardship. So definitely oral health is part of it. Let's have a look at what WHO really tells us. Next slide. The WHO Global Oral Health Program now is integrated into the Department of NCDs, not surprisingly. As you know, when the UN meeting in New York was putting non-communicable diseases high up on the agenda. Luckily so, in the last moment, oral health was part of it. And I'm very happy that they are part of the NCD's agenda. Next. And the oral health program of the WHO is clearly talking about the common risk factors approach with all the other NCDs. and it wants to integrate oral health into the modifiable risk factors such as diet, nutrition, tobacco, alcohol, hygiene, and lack of physical activity. But next slide, oral health, and here they come from WHO, is essential and has to be into an action program. And next, they give a priority to surprise the integration of oral health with general health programs at community and national levels. So all we have said is part of the WHO oral health program that also works like a lot of us around in the life course perspective, looking especially at those who need a special attention, like the young or the elderly. Next. And as we heard from also Shruti and others, this all is integrated into the big charters like Ottawa Charter, Jakarta Declaration, and so forth. So if this is all well said, and we are all thinking that should be done, next slide, where is it? Where is it going on? We have seen interesting reports from Taiwan. We have seen, thanks Mengistu, to something that goes on Ethiopia. But I think there are a lot of countries where what WHO asks is not yet done and not yet fulfilled. And I think that even our colleagues from the three countries, India and Taiwan and Ethiopia, would say there is still improvement possible. And I would come to, next slide, a word that has been mentioned already by Shruti, syndemics. Let's put health into a context. A syndemic or a synergistic epidemic is not two epidemics happening in the same time, or another word for comorbidity, but it means it is the presence of two or more serious broad distributed disease states that adversely interact with each other, kind of creating a negative downward spiral for the population and speeding up the process that is going downhill, if I would say, for the health of the population. Next. So syndemics are especially interesting in NCDs for sure, but also if we combine NCDs with a serious epidemic of a transmittable disease, let's say, talk about Ebola, it will increase the speed of the downward spiral. And this holds true for both high and low income countries. There is no difference. It is just the fact that if we accumulate, it goes faster down the drain, let's say. Next. For example, if we look at some parts of the world, let's say the Eastern Mediterranean region, we have clearly seen that globalization has very quickly and very fast and fundamentally changed dietary patterns and the access to high-calorie food. And so we have an increase of individuals with type 2 and oral health problems, and especially in neglected populations. So we have a very, very fast trend. It happened faster than in, let's say, high-income countries of the common north. What does this tell us? Next slide. It calls upon us to do system thinking, to think the whole thing and not only our part. Even though we are all specialists, we are all good in one part, we have to think the whole system. Now on this picture here, you see the American healthcare system, and not only the American one, but all others are also linked to a money and commercial interest, and we shouldn't forget it. And we have to take into account the fact that healthcare systems are also money-driven systems. But we already heard from Mengistu that we have perhaps in the system one good possibility where we can start And this is, next slide, what he told us about multi-professional work, task shifting, task sharing. The wording is different from place to place. We have a range of professionals in the healthcare sector, and we know by now that we will no longer be able to cover the burden of diseases worldwide and nationwide if we continue to work in our own professions without looking right and left and without having a team approach. The team approach sounds good, but as Mengistu said, there are a lot of hindrances. We heard from Bruce at the very beginning that yes, we have to adapt education. He talked about dual degrees, common curricula. I think this is very interesting and probably important, but I would also talk about the fact that our professions are somehow limiting us, and we should probably think more of competencies than only our professional cage or silo. But to do so, we need sometimes legal frameworks to be adapted. One example was from the US, where the care acts in one state are completely different from the other neighboring state. And this holds true in a lot of other countries where just legal frameworks for professions do not allow team working, teaming up, or task shifting. And for sure, we have to put incentives in place for the team to become a real team. Next slide. So is team still a dream? I hope not. I think it is not. But to make sure what happens at the world level, I was going through the websites and policies of the world professional organizations. Let me start with the policies of the FDI, the World Dentist Organization. Next slide. In their policy, a recent from 2018, they also say that oral health is an integral component of general health. So far, so good. And they also go to dental education, where they say dental education should include sufficient medical knowledge to fulfill the tasks required, because they say that dental professionals can do far more than take care of only the teeth. And next slide, they also have seen that there could be a change in dental curricula and that they could be reviewed in the inclusion of medical science in dental education. And again, you see here, inclusion of medical in dental, very deeply enrooted in our brains. Probably nobody looked at it by looking at dental is not medical or medical is not dental. That goes without saying. We just separate it already in our brains by using these different words. But for this part here, what is missing for me is that, yes, if the World Dental Association says we are going to integrate, I tell you, a team is not working like that. If I say, I'm a team, nice if you join and do what I do, I think we will not make up a very good job, let's say. Next. So I looked at another website, the International Federation of Dental Hygienists. Yes, they see clearly in their policies that they are important, especially for prevention and promotion, but they also talk about the interdisciplinary healthcare teams. So they are more open, let's say, to the team building that is needed. And before I start to go through all these policies, where I think sometimes the main focus is still on the profession and not so much on the team that is needed, I would like to come back to the Taiwan Declaration. Next slide, that has been very well introduced by Shuti already. In the Taiwan Declaration, there is one point that should be mentioned. Among all the activities that also Bruce listed at the beginning, this one is the first time that a World Public Association and a Dental Association together wrote and shaped this declaration. And clearly, we know that we only can go ahead with teaming up if we have the government and the society together. And that we also, like Mengistu showed it very well, have to do it from the planning of primary health care already. And that's where we can already start before we have a super curriculum that will then give rise to a perfectly built up professional again. So what I think is also very important in the Taiwan Declaration, not only it is a joint venture between public health and dental professionals, but also it says that we are at these syndemics of oral, general, and social health. We see crises coming up, like in the US with opioid crisis. We see that the public health education training policy development actions, evaluations have to be seen in a system. If we are not doing it, we will see fast and faster worsening situations. Bruce also mentioned in the US, lack of access, lack of coverage in some places. If we are not doing the actions together, we are stuck, as he said. So, next and for last slide of my resume is, what could we really do? Ways out. What is the practical thing tomorrow? I think we all could work more interprofessional. We can start on a small scale level. I teach at a medical and a dental school. In both sides, I mentioned the other side. Nobody prevents me from doing so. It gives sometimes a little bit of surprise on both sides, but I think we can do it. A lot of us teach in nursing schools, why not make sure that the knowledge goes from one profession to the other? Start the discussion there. Start where you work actually. We are well aware of the common risk approach. We repeat it like a mantra, but I'm not sure that it is known to all the health professionals you're working with. And I think it's worthwhile to come back with it, to underline it, and to mention it wherever possible, and not to be forgotten. And I think that those of you in the dental care who take care of children, or especially the elderly, know how important the social determinants of oral health are. They will show you how much we need the integration, because these are the people who need us most. And then I would call all of you to political action. That does not mean that you have to become a member of a political party tomorrow, or that you have to run for president in your country. I think political action is far broader. Probably you're all member of a professional association. I am member of several professional associations. And why not bring the topic up there? Why not enter the discussion in your professional organization? It is a small level, but it is a start. And yes, and now comes a tricky point, we have to change the incentives. Those who are living well with the actual system are not inclined to change it. I think, Mengistu, you mentioned it also, but there is no way out. We have to put incentives into the direction where we want to go. And last but not least, if we fail, health is a human right. Every human being on this earth has a right to health. And we have to be solidary and not think of us as the medical profession, but of those who we're serving. So I'm calling for solidarity with those we serve. Thank you. Last slide is for all of you. Last slide, please. To say, yes, Geneva is greeting you. Thank you for listening.